Almost good afternoon. Colleagues, it's on your app, the call to action, and hard copies were also made available. So I hope you have a copy of your hard copy. I know we're pressed for time, so I'll take you through the call, not too fast. And at the end, what we're hoping is that you would show your support for the call. So if you support it, you can stand up and clap hands. If you don't support it, you can sit down. But standing up, as you know, is good for your circulation and good for exercise. So let me start. The World Federation of Public Health Associations demand for action from Melbourne 2017. On the occasion of the Federation's 50th anniversary and the Melbourne World Congress on Public Health, we, the partner organizations, with the delegates from over 83 countries, gathered in Melbourne, Australia, from the 3rd to the 7th of April 2017 for the 15th World Congress on Public Health to celebrate the 50th anniversary of the World Federation of Public Health Associations. Together, we articulate our concerns for the public's health and demand world leaders to make the public's health a priority. Public health professionals and the institutions that represent them need to engage with leaders for the following reasons. Firstly, globalization is making us more dependent on one another, which means increasingly the health of one person is intrinsically linked to the health of others. Secondly, there is evidence of the impact of social, environmental, political, and economic determinants of health on the public's health, with opportunities to design environments that will support healthy choices. At the same time, there are huge risks for the public's health if opportunities to design environments that will support healthy choices are not fully exploited. Thirdly, security and stability, while responsibilities of individual countries are also linked to shared global governance. The right to health can only be enforced if a sustainable health system with efficient public health functions is available in every country. Lastly, the effectiveness of the health system and its public health functions in one country impacts on health and health services of other countries. As the only non-governmental organization representing the broad interest and voice of public health at a global level, with the support of our partners and the delegates, we make the following demands. Firstly, voices, our commitment. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of society. Health systems and public health functions can be treated as global public goods. It is the role of public health professionals and their organizations to contribute to improving health outcomes for all, and secondly, fighting inequity as the primary driver of poor health, with particular emphasis on women, children, indigenous peoples, as well as poor and marginalized communities. Demanding political, social, environmental, and economic change across all sectors for better and more sustainable health. Our vision on building on the past and looking to the future. We recognize the role played to improve health through the Alma Ata Declaration of the Declaration of Alma Ata in 1978, the Ottawa Charter on Health Promotion in 1986, the Rio Political Declaration on Social Determinants of Health in 2011, the United Nations Sustainable Development Goals of 2015, the 2016 Shanghai Declaration on Promoting Health in the 2030 Agenda for Sustainable Development, and a series of declarations from preceding World Federation of Public Health Association World Congresses on Public Health. We seek to build on these in our work over the last 50 years. Our future vision for a healthier world is based on the Global Charter for the Public's Health and includes protection, prevention, and health promotion, and also draws on the UN Sustainable Development Goals. Our action, using different sets of knowledge, tools, and skills, as public health professionals, we strive to fully apply the mechanisms available to government, industry, private enterprise, academia, and civil society to protect the public's health, embrace prevention, and promote health and well-being. We will make full use of social innovation and interactive technologies to encourage and support governments to promote equity and social inclusion while harnessing the knowledge, skills, and priorities of our diverse populations through strong community engagement. As public health professionals and those organizations that represent them, we will work to reorientate systems and strengthen ties for better health outcomes for all as we commit to the following actions and demands. So if you haven't listened to me so far, this is the bit that I really want you to listen to, that you're agreeing to. So firstly, our demand for action applies to all organizations that have an impact on people's health, on people's lives and health, and they include governments and government bodies at local, regional, national, and international levels. Civil society, including all non-governmental organizations, universities and other educational institutions, corporations, and businesses. We demand all organizations and individuals with variable levels of influence to firstly confirm the World Health Organization's definition of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, and health as a human right. Secondly, to strengthen legislation, regulation, and taxation of unhealthy commodities. Thirdly, implement fiscal policies as a powerful tool to enable new investments in health and well-being. Fourthly, strengthen global governance to better address cross-border health issues. Increase funding for sustainable health systems with universal health coverage. Support strong global instruments such as the Framework Convention on Tobacco Control to curb the power of industries that produce products harmful to health. Oppose international treaties that exacerbate health inequities and poverty or are inconsistent with poverty reduction, civil and other wars that displace large groups of people, and exclusionary processes that disadvantage entire regions, countries, populations, or communities. Commit to economic, commercial, financial frameworks for policy and law internationally and nationally that are positive for health determinants and promote societal justice. Some such frameworks include those relevant to taxation, trade, investment, business, currency, and banking. Use our capacities to train and empower the next generation of public health professionals to build upon health gains made to date, and commit to protecting human rights, social justice, equity, and environmental sustainability, and promoting social responsibility. Where people are at risk in emergencies, instability, insecurity, and disasters, we commit to use our knowledge, tools, and skills to work with a wide range of partners to improve health outcomes, provide support for implementing country and community capacities in health and other sectors to manage the health risks associated with emergencies, instability, insecurity, and disasters, and comply with the World Health Organization's international health regulations. As national public health associations and public health professionals, we commit ourselves and call on others to join us to promote protection, promotion, and prevention in the context of good governance in relation to nations, international agencies, and corporations, improved public health capacity, particularly by supporting a stronger public health workforce, more effective public health advocacy, collection and dissemination of accurate public health information. Our call, in conclusion, you'll be pleased to know I'm on the last two sentences, In the context of these demands, we call on governments to enable public health professionals and their organizations to carry out their work to develop further public health functions and quality health systems as global public resources. We also call on governments to hold all sectors accountable for the health impacts of their policies and actions, consistent with the intent of the social determinants of health and the responsibilities to strive to achieve the Sustainable Development Goals. Colleagues and comrades, I'm now going to ask that you show, either by standing up and sitting down, your support for the declaration. Thank you so much, and siyabonga, which also means thank you. Thank you to all of you, and of course, thank you also to the wonderful tool of peer pressure.